We needed to introduce folks to what the PHIG funding could potentially mean. So we started out with listening tours. We went to every area in public health, and we just wanted to listen. In our listening tours, we wanted to hear from our staff directly. What do you feel like is missing at work? What brings you joy at work? You know, what makes you happy? And what we did was we actually constructed a survey, and we asked the same questions in every area, and then we were able to pull all that data together, and that helped us to more refine what we needed to actually offer and how to best use these funds to really meet the needs of our staff. After the listening sessions, we determined, after taking a look at the survey data, that we really wanted to build out some programs to enhance what was already being offered at Wake County. So we actually started focusing more on internal wellness, and what we heard from our staff is that they still feel some of the impacts of COVID-19 and because of life stressors. So we actually moved towards offering quarterly wellness offerings. For example, our next offering is going to be a holiday-themed offering, understanding that sometimes the holidays may not be the best time of year for a lot of people, right? There may be some struggles or something going on during the holiday time. So we want to take care of our folks, and we're doing a tailored offering where we can offer chair massages, people can make a handmade craft, they can just come together with their colleagues, or even just sit solo and just do something that brings them joy, helps them to relax, to maybe get away from their work day and to have something to take home with them. And also, we have selected an organization to continue wellness-related offerings. They're a national organization, so they're going to continue with virtual wellness-related sessions and in-person sessions from local professional counselors, local clinical social workers, and we're going to continue to kind of tailor those out. So our first clinician is already ready to go with our virtual and in-person offerings, and they're going to talk about things like workplace stressors, conflict resolution, preparing for the holidays, and then after that we're going to test it out pre and post, and depending on those findings we're going to continue to make sure that we gear our wellness related clinical offerings to again meet the needs depending on the themes that are emerging from these initial sessions. Because of the PHIG funding, we've helped staff to build more resiliency, and we've also helped staff to be more aware of what's available to them as a Wake County employee on the whole, but also what's available to them because of PHIG funding. So I think when staff members engage, whether it's in the clinic or in the community or just with one another, because of some of the programming and some of the initiatives that we've been able to put forward, folks frankly feel better. And I think that's important. There's a lot of research around joy in work, and you just can't get away from how behavioral health and mental health just really impacts people at work and at home. So why not answer that at work as much as we can, and we've been able to do that with this funding. There's nothing better than coming to work and feeling psychologically safe. And that's very difficult to achieve in any space, but I think most especially governmental spaces. And I think, being in this kind of middle space in workforce development and having the opportunity to have conversations with boots on the ground and also have conversations with leadership, it puts us in a unique space where we can really impact systems. So it's really exciting. This funding has been just an amazing opportunity to be truly impactful. We're able to offer services that are outside of the traditional, checking the box of, okay, you can have this training, or okay, we're gonna gear this training for this particular area. We can actually listen, we can take time, we can say, okay, this is what we're hearing from all of our staff members, and as a result, we can tailor to say, and then we can bring in others from the community to really say, we care about you. We realize that you may not be able to kind of make that distinction between, home stressors or work stressors. We want to equip you to just be a better public health servant, leader, no matter where you are. And you can use those skills, those supports at work, and also outside of work.